It's time for Back to Life, brought to you by Southwest Spine and Pain. A 30-minute conversation with their board-certified physicians about how to live life again, pain-free.
Hello and welcome to Back to Life with Southwest Spine and Pain. I'm here today with Dr. Derek Frieden, who's going to be speaking with us. He's a partner at Southwest Spine and Pain. So, Derek, take it away.
Okay, Mike. What I thought I might do today is spend a little bit of time talking about spinal cord stimulation. A lot of the U.S. adult population suffers from chronic pain, approximately 20 to 30%. Spinal cord stimulation is an option that helps a lot of folks that have not responded to more conservative therapies such as physical therapy, chiropractic care, surgery, injections. These are the folks that are usually found to be good candidates for the technology. The spinal cord stimulation consists of a small electrode that's implanted into the spinal canal, and through a small electrical charge, we're able to block the pain signal from reaching up to the patient's brain. So it doesn't solve the reason why they have the pain, but it blocks the pain signal so that the sensation of the pain is significantly decreased.
Okay, awesome. So what type of patients or what type of injuries, I guess, would people have or suffer with that would lead them to come and visit you, doctor?
Yeah, that's a good question. A lot of the patients that we see have had surgery that is not alleviated their pain, or it's helped some of the pain, but they still have persistent pain. Often they'll have pain in the back or down the leg. It could be pain in the neck or into the arm. There are also other patients that have a pain syndrome called CRPS, or complex regional pain syndrome. It used to be referred to as reflex sympathetic dystrophy. The nomenclature has recently been changed just because of the complexity of the condition. Those are patients that will often have pain resulting from a minor injury, such as a sprained ankle, a minor surgery. I've even had a lady that was swinging around on a chair and kicked her desk and injured her foot and ended up having this type of issue. What they'll often get is swelling, discoloration of the limb. It's very difficult to treat. We often try to treat it with medications that help settle down the nerves, but if that's found ineffective, they often respond very nicely to the spinal cord stimulator. The nice thing with the spinal cord stimulator is the patients get to test it for a few days before we do the permanent implant. So what typically happens is they come in to the operating room and the electrodes are placed through the skin, and then they go home with the device for 4 to 5 days so they can get a sense of whether it's going to be helpful or not. It's a same-day procedure. It's done under local anesthetic and mild sedation. It doesn't involve any incisions. So after they go home, they get to test it out for a few days, and then they come back, and really at that point, they tell the provider whether they think it's beneficial or not. We'd typically like to see at least 50% relief and hopefully more. If they experience that amount of relief, then we schedule them 4 to 6 weeks later to get the permanent device placed. We like to have a few weeks between the trial and the implant to lessen any chance of infection.
Oh, perfect. So I guess how does the home procedure work? Like when they're testing it for themselves, what kind of processes do they go through?
So we encourage them to go about their regular activities for those 4 to 5 days. We don't want them to soak in a tub or get it wet because it could cause an infection, but we encourage them to walk, go to dinner, do the dishes, do some of the activities they would normally do, so we can see if it not only helps with the pain, but also helps with their function and their ability to do more of their daily activities. Some people will keep a pain journal that they fill out. Most patients just keep a mental note of how much relief they experienced and how much activity they were able to increase. Another thing that we often will see is that they're able to take less of their pain medication while they have the device in, and that's usually a good indication that they'll do favorably with the device.
Perfect. Yeah, less medication sounds good to me.
It's always a good thing if they can decrease their medication, especially some of their opioid-based medications. I'm sure everyone's aware in the media some of the issues we're seeing with those. And while they certainly have a role for patients in chronic pain, any chance we have to decrease or get patients off those is always a good thing for the patient.
For sure, I agree. So what type of, I guess, success rate do you normally see with this procedure and with the stimulus?
So in our practice, we're approximately 75 to 80% successful of our implant patients.
Wow.
So we're fairly conservative on the patients that we'll trial. There are other areas where the implant rate may be higher or lower. After doing it for many years on many patients, you start to get a feel for who you think is likely to be a good candidate and who will have a good response, but you never can tell for sure until you've done the trial. And we like to say there's no harm or shame in a failed trial. What we don't like to see is a failed implant. And every now and then we do see that. A patient will do well during the trial. We do the implant, and over time they'll say that it's not as effective as they would hoped it would be. But in our practice, close to about 80% success rate if we go out 6 to 9 months and check and see how patients are doing and how they're feeling. Every now and then I'll have a patient that's not sure if it's working or if it's doing enough. So 90% of the time I'll encourage them to turn it off for a few days, and they'll turn it off, and then usually they'll come back and tell me it's actually doing more than I thought it was, and then they don't want it taken out. For those few patients that it does fail, it can be taken out. It's about a 30-minute procedure to take the device out. The permanent device has a small generator that's placed under the skin, usually in the back or the flank area. There's a small incision, and that's pocketed under the skin. So to run the device, they have a small remote control device that they carry in, their purse or their pocket. It's not much bigger than an iPhone, and they have the ability to remotely turn the device on or off, up or down. So some patients, when they're out, say at the mall shopping, they may feel their pain's increased. They can turn their remote, take it out, and click it up a couple of notches and make the sensation stronger to help block the pain. Some people like to turn it off at night. The majority of patients, they'll find 2 or 3 settings, and they usually stay within those couple of settings.
Okay, that makes a lot of sense. So I guess then the device itself, what is the physical, I guess, what is it actually doing to your body? What is it doing to your body when you turn the device?
Yeah, so the way it works, the spinal cord has tracks where the nerve signals run up and down the spinal cord to our brain where we perceive the pain. Mm-hmm. And as luck would have it, the main tracks that carry the pain signal are in what we call the posterior or the back portion of the spinal cord. So by placing small electrodes on top of the ligament that covers the spinal cord, we can put an electric current that goes through, and it inhibits those tracks from sending those pain signals up any further. Okay. So an analogy is, and we see back in history, our grandparents were actually great pain doctors before they even knew it. So when you're little and you fall off your bicycle, grandma comes and rubs it. And what she's doing is she's activating what we call A-beta or beta fibers that can inhibit the small fibers from sending the pain signal. Oh, okay. So we are able to do a similar technique through these electrodes at the spinal cord level that block the small pain signals from firing and traveling up the spinal cord.
Wow. So is there any damage that the device can do to someone? Can it worsen the pain?
Not that we're aware of. There's always risks, like when you do the procedure, like with any surgical procedure, bleeding, infection, and nerve damage. But those are exceedingly rare when they're done in people that are trained in the technique and have experience. The long-term effects, we're unaware of any long-term effects because we're simply just using a small electric current, which is what the nervous system runs on. Our whole nervous system runs on electricity and is one big electrical current running up and down that spinal cord and through the spinal nerves. So we're almost tricking the body in a way that we won't perceive the pain. So one question I commonly get from patients is, well, how will I know that I'm not injuring myself more? And what I explain to them is you still have sensation. So if they were to step on a tack or something hot would have poked them, they would still feel that pain signal.
Okay.
So then they're not likely to damage themselves any further. If they were to bend too far or twist too much, there are other receptors in the joints, ligaments, and tendons that would signal that they're causing harm and they should stop what they're doing.
That makes a lot of sense then. That's smart. And I like, too, that it's natural. It's doing what your brain and your body does anyway, instead of like the meds like we were talking about before.
With the medications, often you can develop a tolerance or resistance to them over time. But with the spinal cord stimulator, we're not aware of any resistance developing over time. So there are patients in our practice that have had these stimulators for 12 plus years. There are other patients that have 20, 25 years. You know, this really came about in the late 80s, early 90s is when it became more of a popular therapy. Mm-hmm. What I can tell you is the device from when I first started doing it to now is improved dramatically. Just like your iPhone, over time it continues to get better and better. And this year, most of the device companies have come out with new generations of their spinal cord stimulators. There's 4 main device companies. There used to be 3, and then a new one called Nevro recently came to market. Nevro is somewhat unique because it has a high frequency, so it's a frequency that's high enough that you can't feel the sensation of the stimulator when it's on.
Wow.
But it still seems to block the pain. The other companies are Medtronic, St. Jude, and Boston Scientific. They can also run a high frequency, but not quite as high as Nevro is able to go.
Okay. So which one does Southwest Spine and Pain use?
We've used them all. There's no clear evidence that one is superior to the other. Mm-hmm. I think a lot of it is clinician experience, and then sometimes depending on the symptoms that the patient presents with, whether it's back pain, back and leg pain, extremity pain. They've also had a lot of success with patients with intractable migraine headaches or occipital neuralgia. They can be implanted under the skin in the back of the neck that help control headaches.
Wow, that's awesome. And so I guess some different questions people might have is, since it uses shock, do you feel the shock? Is there any pain or any spark?
So it's not a shock. It's a gentle stimulation. Mm-hmm. So on the devices, people describe it as a warm, buzzing, tingling sensation. So what I equate it to is if you're driving down a country road that's a little bit bumpy and you feel your knee vibrating against the door, if you consciously think about it, you can feel that vibration. But after 20 miles, you start to forget about it. It's not hurting you, it's just there. And most of the patients I talk to that have it, they get used to the sensation and they forget that the sensation's there. With the high-frequency stimulation, like I said earlier, we can have it high enough that you don't feel anything at all. There are some patients that go back and forwards between the two. So some patients may prefer the high frequency at night when they sleep and have the regular frequency during the day or vice versa. So there's more flexibility than what we had even 5 years ago with the devices. The other encouraging thing is the generators have gotten much smaller. So some of the implantable generators that run the device are now not much bigger than a quarter.
Wow. Yeah, that was my next question was, how does it affect, I guess, your appearance? How big are the machines themselves?
Yeah, so they continually get smaller. Most of them, if somebody had their shirt off, you would see that there is a small protuberance under the fat. Obviously, the skinnier you are, the more it'll poke out. Some people have a little more room where we can tuck the device in. But usually, it's not an issue. People rarely complain about the device. If we're careful where we place it, it's usually not an issue.
That's awesome. That's way awesome. So what other questions, doctor, do you usually get with your patients that are considering or maybe thinking about other options? What are some of the things that they personally ask you?
So one of the things we try and discuss with the patient is what have they had to treat their pain before. This isn't something we want to jump to first line. So again, have they done physical therapy? Have they seen their chiropractor? Have they had injections? Often I'll have them see a spine surgeon to make sure that there's not something surgically that can be fixed. If there's something that can be surgically fixed, then that may be the better road for most patients. Now, we have some patients that are elderly and they may be not medically cleared to have a surgery, or if it's a big level fusion, it may not be safe to put them under the general anesthetic for, or the recovery may be too long. Sometimes, and we work closely with our surgeons, in southern Utah, and they all have experience with spinal cord stimulators. So they'll often also look at a patient with us and say, I think this patient may benefit more from a spinal cord stimulator versus I think surgery may be the way to go. So we'll often consult with our surgeons and see, do they think there's something there that can be fixed or not. Awesome. The other, every now and then we have somebody that they just say, I just don't want surgery for whatever reason. They're nervous about it. They just are adamant, and we can do a trial and see how they do. And again, the nice thing is really with the trial, they get a really good sense if this is going to be something that's going to give them a favorable outcome. Because what we don't want to do is put them through the trial or the surgery and the device and then find out that it didn't really help them.
Definitely. Doctor, we're going to take a quick commercial break, but after just 1 minute, we'll be right back to talk some more about the spinal cord stimulator.
Yep.
Is that right? Awesome.
Sounds great.
Think of those moments, the simple moments, the ones where just turning your head, putting on your shoes, or even just a sneeze or cough makes you double over in pain. At Southwest Spine and Pain, we get it. We see it every day. The moments might be different, but the reality is the same. Pain. Pain doing the things you love, and pain doing the simple and small things that you wonder if you ever could be able to do again. If this pain sounds familiar, we can help. At Southwest Spine and Pain, our team of board-certified physicians bring a level of expertise that helps us deliver a solution, not just pain management. Our team uses state-of-the-art equipment, proven technology, and cutting-edge medicine like stem cell therapy with one goal in mind, getting you pain-free. Give us a call at 435-656-2424 or visit our website at southwestspineandpain.com to hear what our patients have to say. You deserve to live life again. Let us help at Southwest Spine and Pain. Call Southwest Spine and Pain today at 435-656-2424.
Welcome back to Life with Southwest Spine and Pain. We're here again with Dr. Derek Frieden, one of the partners at Southwest Spine and Pain. And Doctor, we've been talking a lot about the procedures and about the different types of machines and things that work. What are some of the things you've done with your own patients? What kind of patients do you have come and visit you?
Yeah, so we see a lot of interesting patients in our practice, and we see pain conditions from neck pain, jaw pain, headaches, back and leg pain are some of the more common ones that we see. We see some patients with cancer pain. A couple of patients come to mind with the spinal cord stimulators that I've done over the years. I had one gentleman that was a returned veteran from the Gulf War that had 2 to 3 back operations and unfortunately still had very debilitating low back and pain down into the extremities.
Wow. And
for actually 2 to 3 years, we worked on getting a stimulator trial approved. We had some insurance issues, which is unusual, but in this particular case, it took a little bit of time to jump through all the hoops. And once we finally did the trial, he had a fantastic result, and then we were able to put the permanent device in, and he's had a dramatic improvement in his pain, being able to significantly decrease his pain medication, and is now back active with his kids, and very appreciative and very grateful that the technology exists, and we saw a dramatic improvement in his quality of life. And I have another elderly lady that I recently implanted a few months ago, and when we first saw her, she was just in terrible pain, tearful, depressed, having anxiety because of the pain. It would really cause her a lot of discomfort. It was hard for her to sleep. She was on a fair amount of pain medication, but unfortunately nothing would really get on top of her pain. Mm-hmm. So we did a few injections, we did a few other things, and we got some of her pain sorted out, but then the back and the leg pain persisted. So again, we did the trial, and she had a really good result, and then after we put the implant in, she's probably 3 months out now, and she's off all the pain medication, she's sleeping, she's significantly improved, she reports to me that a primary care provider can't believe how good she looks. You can see her spirits are up. She's got a little. She's actually quite a funny old lady, and now that I've got to know her more over time, she's perked up, and she's more. You can see her spunkiness has come back, and a kind of a zest for living. So that's been really exciting to see. And there are lots of stories with lots of patients that it can really dramatically affect their quality of life, and it's really a lifeline for them, because without it, often we've exhausted every other option that would likely lead to significant improvement for them.
Okay. And so like you were just saying, is this kind of like your last option, or is it something that you can look at as well if other things aren't working out for you?
So when I first came out of training back in the probably 12 to 13 years ago, it was back then the technology was still evolving. Even though we had it, the devices weren't quite as slick and programmable as they are now. So it used to be that was the end of the line. Now with some of the problems that we're seeing with the opioid-based medications, complex regional pain syndrome, if we're not aggressive on the treatment of it earlier, the spinal cord stimulator is actually moved up in the algorithm of how we look at pain and when we introduce it. So it's still not a first-line therapy, but I think for a lot of folks, we don't necessarily have to wait until they've been suffering with the pain for a year or two and everything known to man is exhausted. There's a rationale when a few things aren't helping, or they're helping but not lasting, we'll move along to the stimulator sooner than we typically have in the past.
And the stimulator is a lasting solution, right, for the most part?
Yeah, for the majority of patients, once they have it, for that issue, it seems to provide them relief for a long time. Now, that doesn't mean other things can't happen. They may get a new disc herniation. They could get developing arthritis in another area. They may fall and hurt another part of their extremity or spine. The stimulator, where it helps, is for nerve pain, so it doesn't necessarily help for mechanical pain. So if somebody's got osteoarthritis of the knee, or the joints degenerated, or there's a traumatic injury there, it may not help with that kind of pain.
Okay, that makes a lot of sense. And then I guess another question too is, if someone is considering this, what are some of the procedures or things they have to go through to prepare to receive the machine? So
once we see a patient that comes in, we'll do an extensive history and physical exam. We'll review any existing imaging that they have. There's some specific images we want. Even though they may have low back pain, we'll want an MRI or a CT scan of the thoracic spine, just to make sure that there's enough room for the leads to go in. In all the time I've done these, I've not had a patient where they haven't had enough room, but it's always cautionary just to be sure. The electrode itself is only a few millimeters in circumference. It's very small. It's somewhat like a large spaghetti noodle, if you think of the size of that. But if somebody had severe stenosis in the thoracic spine or a large disc herniation, that may be a contraindication or something that would need further workup. Then the other thing is we'll get a behavioral health evaluation, and that's mandated by most insurers and Medicare. They just want to make sure that the patient is sound mental health, that they can tolerate the idea of the stimulator being in them, and also that it hasn't been oversold or that they have unrealistic expectations. So if a patient came in and had the expectation that this was going to cure them of their pain and make them feel like they were 16 again, that's probably unrealistic. If they had an understanding or a hope that they may get 50% improvement or more and some increase in their function, that's a realistic outlook on having the device itself.
Okay.
And the other thing we would get prior to doing the trial of the implant, we would run some basic blood work just to make sure there were no infections, urinary tract infections, or anything that would be a contraindication, or we might have to wait a few weeks to get them some treatment for that before we could go ahead and proceed with the trial.
And you said that the trial is usually same day?
So it's not the same day that we see the patient, but once we get everything set up, then the trial itself can take anywhere from 10 to 30 minutes, depending on the anatomy, whether they've had multiple surgeries and hardware, how narrow the spinal canal is. Technically it's not extremely difficult to get these leads in place. Often we'll spend more time programming. So once the leads are in place, we have a rep from the company that helps us program the device. So we'll want to make sure that they feel the stimulation in the appropriate area. Once they feel it in the appropriate area, we tape the device in, we take them to recovery, and usually they're in recovery for 20, 30 minutes, and then they go home.
That sounds awesome. That's way awesome. Doctor, one last closing question that kind of came up is, how old are your patients normally, or is there an age limit?
We don't do a lot of pediatric patients, but we've seen patients anywhere from 20 up to 90. So there's no real limit on the age of the patient. It's more the underlying disease and the level of pain that we're trying to treat.
Awesome. And doctor, is there anything you'd like to share with our listeners before we close up today?
No, I think in summary, this is an exciting technology that we're glad that we have, and this will continue to improve patients' lives. I've seen dramatic improvement on many patients that I've implanted and my partners have implanted, and we're encouraged that the companies continue to improve. Now's an exciting time to be in spinal cord stimulation because the technology continues to improve, and we're excited about the therapy and the relief that it provides our patients.
Awesome. Thank you so much.
Good.
Thank you, everyone, for joining us today with Dr. Derek Frieden. We hope that we'll see you again, Doctor. And please join us again next week for Southwest Spine and Pain's Back to Life show. Have a great week.
Join us for Back to Life every Monday at 5:30 p.m. here on St. George News Radio, where board-certified physicians from Southwest Spine and Pain discuss different alternatives to live life again pain-free. For more information, go to southwestspineandpain.com.